Welcome to today's video. In the next 10 minutes, we will provide a professional guide on the importance and techniques of breastfeeding. We'll cover the scientific significance and benefits of breastfeeding, common breastfeeding issues and nursing tips, how to choose and use a breast pump, and also recommend some well-reviewed products. This video is designed to help new moms gain knowledge and confidence to successfully navigate the breastfeeding period. Scientific research and practice have shown that breastfeeding brings tremendous benefits to both babies and mothers. Breast milk is the ideal natural food for infants, providing balanced nutrition and unique immune factors that no formula can fully replace. Major health organizations, such as the WHO and the American Academy of Pediatrics, recommend exclusive breastfeeding for the first 6 months of life and continuing breastfeeding with complementary foods up to 2 years or beyond. For the baby, breast milk provides the perfect mix of nutrients to fully meet an infant's needs in the first 0 to 6 months. It is rich in antibodies and immune factors that strengthen the baby's immune system and reduce the risk of infections and illnesses. For example, breastfeeding lowers a baby's chances of common infections like respiratory illnesses, diarrhea, and ear infections, and also reduces the risk of later developing asthma, obesity, type 1 diabetes, and sudden infant death syndrome, or SIDS. In addition, breastfeeding supports the baby's physical growth and brain development. The close skin-to-skin contact during nursing provides comfort and fosters a strong bond and sense of security between baby and mother. For the mother, breastfeeding has many health benefits as well. Firstly, nursing triggers the release of oxytocin, which helps the uterus contract and reduces postpartum bleeding. Breastfeeding also burns extra calories, aiding postpartum weight loss and recovery of the mother's figure. In the longer term, extended breastfeeding can lower the mother's risk of diseases such as breast cancer, ovarian cancer, type 2 diabetes, and high blood pressure. Moreover, the act of breastfeeding strengthens the emotional bond between mother and child, which can help ease a new mother's anxiety and provide psychological satisfaction. In short, breastfeeding has positive effects on a mother's physical recovery and long-term health. Common breastfeeding problems and nursing techniques. Latching difficulties. Some newborns have trouble latching onto the breast at first, which can cause pain for the mother or result in the baby not getting enough milk. The key is to ensure the baby's latch is correct. Mothers can try different breastfeeding positions, such as the cradle hold, football hold, or side lying, to help the baby take in the nipple and a good portion of the areola for a deep latch. A baby who latches onto a large part of the areola will get milk more effectively and cause less pain for the mother. If persistent latching issues occur, consider consulting a lactation consultant for professional help. With patience, practice, and positional adjustments, most latching problems improve within a few days. Sore or cracked nipples. In the early stages of breastfeeding, a mother's nipples are tender and improper. Latch can easily lead to pain or cracking. The first step in management is to check the baby's latch. An incorrect latch is the most common cause of nipple pain. Ensuring the baby takes in a larger portion of the areola and adjusting the nursing position can greatly reduce nipple friction and pain. After feeding, the mother can apply a medical-grade lanolin cream or even a bit of expressed breast milk to the nipples to soothe and moisturize the skin and allow them to air dry to promote healing. Between feeds, using nipple shields or cool compresses can help alleviate pain. If severe pain persists or there are signs of infection, be sure to consult a doctor. Remember that ongoing intense pain is not normal and is one of the common reasons mothers wean earlier than planned. With a corrected latch and proper nipple care, most nipple soreness issues improve. Breast engorgement. Around 3 to 5 days postpartum, many mothers experience very full, firm breasts, also known as engorgement, as mature milk comes in. Engorged breasts can be painful and make latching difficult. To relieve engorgement, try applying a warm towel to the breasts and gently massaging them before feeding or pumping to help improve milk flow. If the breast is so hard that the baby struggles to latch, you can express a little milk by hand or pump just before feeding to soften the areola, then let the baby nurse. Frequent nursing is the best remedy for engorgement. Feed on demand to ensure the breasts are emptied regularly. Be sure to nurse on both sides in turns so one breast doesn't become overfull. After feeding, you can use a cold compress on the breasts to reduce swelling and discomfort. Engorgement is usually temporary. As your feeding routine establishes, your body will adjust milk production and the discomfort will ease. Plugged ducts and mastitis. If you feel a localized tender lump in the breast, it may be a clogged milk duct. If it's accompanied by fever, redness, and pain, it could have progressed to mastitis, a breast infection. To address a clogged duct, the strategy is to remove the milk buildup. Nurse frequently on the affected side and/or use a breast pump to help drain the breast. Applying warmth and gentle massage before feeding or pumping can help clear the blockage. When nursing, try positioning the baby so that their chin points toward the area of the lump, which can improve drainage of that section. Even if mastitis symptoms arise, doctors usually advise continuing to breastfeed or pump because keeping the milk flowing aids recovery. It's critical to seek medical attention promptly, as a doctor may prescribe antibiotics to treat mastitis. During this time, the mother should rest and stay hydrated. If feverish, she can take acetaminophen or other fever reducers as directed by a physician. In most cases, with prompt management and continued milk removal, a plugged duct will improve within a day or two, and mastitis will also resolve quickly with treatment. Many new mothers worry that they are not producing enough milk for their baby. This perceived low supply is often a false alarm, though in some cases there may be a real milk supply issue. To tell if your milk supply is sufficient, monitor your baby's weight gain and diaper output. If your baby has at least 6 to 8 wet diapers a day and gains weight steadily, your milk supply is likely adequate. If you do need to increase supply, the best approach is to nurse more frequently. Breastfeeding works on a supply and demand basis, so frequent nursing or pumping will signal your body to produce more. You can also use a breast pump between feedings for extra stimulation, and try skin-to-skin contact, also known as kangaroo care, to boost oxytocin and prolactin hormones that help milk production. Ensure you get plenty of rest, eat a balanced diet, and stay well hydrated, as these factors support maintaining a good milk supply. If you truly suspect a low supply, consult a lactation consultant to develop a plan for increasing milk production. Studies show that worries about inadequate milk, along with nipple pain and latching difficulties, are major reasons many mothers wean earlier than intended. Therefore, seeking support in time, properly assessing your supply, and taking action are crucial. With guidance, most mothers can produce enough milk for their babies, so have confidence in your body's ability. Those are the common breastfeeding challenges and their solutions. In general, do not get discouraged when facing difficulties. Seek help from professionals and experienced moms. By mastering these scientific nursing techniques, most issues can be resolved, allowing mother and baby to continue breastfeeding successfully. Types of breast pumps and how to choose. Manual breast pumps. Manual pumps are operated by hand, usually simple in design, compact and lightweight, and require no electricity. The advantages are that they are affordable, nearly silent, and easy to carry, making them ideal for occasional use or as a backup when traveling. For moms who only need to pump infrequently or who need a quick solution on the go, a manual breast pump is a great choice. The downside is that you have to physically press or squeeze the pump repeatedly, which can be tiring over long sessions, and the milk expression efficiency is relatively low. Therefore, manual pumps are not the best choice if you need to pump frequently or for a long duration. Single electric breast pumps. This type of pump uses a motor to create suction and can only pump one breast at a time. Single electric pumps are often more compact and slightly less expensive than double pumps, and they can be easier to carry around. For mothers with lower milk expression needs, or those who mostly breastfeed directly and only occasionally need to pump, a single electric pump can be sufficient. The advantage is that it spares you the effort of manual pumping. Many models offer multiple suction levels and a massage, stimulation mode to mimic a baby's natural sucking rhythm for better comfort. However, since it only pumps one side at a time, its efficiency is lower than a double pump. For moms who need to pump frequently or are pumping on a schedule after returning to work, a single pump will take twice as long to empty both breasts. So when choosing, you need to balance convenience against efficiency and decide if a single electric model meets your needs. Double electric breast pumps. These pumps can express milk from both breasts simultaneously, and they are one of the most popular choices among breastfeeding mothers. A double electric pump significantly improves pumping efficiency, as you can empty both breasts in the same amount of time, which is especially important for working moms or those who need to pump frequently, like multiple times a day. Many double electric pumps feature a two-phase mode, a fast, gentle stimulation phase to trigger letdown, followed by a slower, stronger expression phase. This design more effectively extracts milk by mimicking a baby's natural sucking pattern. Using a double pump also helps maintain milk supply evenly in both breasts. On the downside, double pumps are usually a bit bulkier and more expensive than single pumps, and some models must be plugged in, though others come with rechargeable batteries. Overall, if your budget allows and you anticipate pumping often, a double electric breast pump is a worthwhile investment. It enables moms to obtain more milk in less time. Wearable breast pumps. With technological advances, new wearable breast pumps have become increasingly popular in recent years. These pumps integrate all components into a breast cup, making them compact enough to fit inside your bra without external bottles or tubes, which keeps them quite discreet under clothing. Wearable pumps are usually double electric and battery-powered, allowing moms to quietly pump while going about their daily activities, truly hands-free. They are great for mothers who need to pump while working, or who want to be low-profile when pumping in public. For example, the LV and Willow are well-known wearable pump brands that even pair with smartphone apps to monitor pumping progress. However, the drawbacks of wearables are their higher cost, and due to size constraints, slightly lower suction power and milk storage capacity compared to traditional pumps. Some users report that wearables don't always yield as much milk as standard double electric pumps. Therefore, many moms use a wearable pump as a convenient supplement for outings or special situations, while relying on a more powerful traditional electric pump for their main daily pumping sessions. If privacy and convenience are top priorities, a wearable pump is an excellent choice. But if maximum efficiency and output are your main concerns, you might still depend on a conventional double pump. Tips for choosing a pump. When selecting a breast pump, aside from the type, consider the following practical factors. First, suction strength and adjustability. Stronger suction is not always better, as overly high suction can hurt your nipples. The key is having finely adjustable suction levels and a comfortable massage or stimulation mode. Second, check the flange or breast shield, size for fit. Every mom's breast size is different, and a proper fit ensures efficient pumping without pain. Some brands offer multiple flange sizes or interchangeable shields to suit different needs. Third, pay attention to material safety and anti-backflow design. Choose pumps made of safe BPA-free materials and preferably a closed system that prevents milk from flowing back into the motor to keep the milk hygienic. Fourth, consider ease of cleaning and noise level. The easier it is to disassemble and wash the parts, the better, and a low-noise design allows you to pump at night or in an office without disturbance. Finally, think about portability and power according to your lifestyle. If you travel or move around often, look for a compact model with a long battery life. If you'll mostly pump in one spot at home or work, you might opt for a larger model with more features. In summary, choose a pump that best fits your personal needs and budget to get the most suitable one for you. Breast pump usage tips and precautions. Preparation before pumping. Before each pumping session, make sure to wash your hands thoroughly to maintain hygiene. Also, check that all pump components are clean and correctly assembled. If you are using an electric pump, ensure it's plugged in or the battery is charged. Prior to pumping, placing a warm towel on your breasts for 1 to 2 minutes and gently massaging can encourage your milk ducts to open and trigger a letdown reflex, making the subsequent pumping easier and more effective. Being relaxed will also help your milk flow, so choose a comfortable, private spot to sit, take a few deep breaths to calm yourself, and then begin pumping. Proper pumping technique. Center the pump's flange, breast shield over your nipple and gently press it against your breast to ensure an airtight seal. If the flange size is correct, your nipple should move freely in and out of the tunnel with each suction cycle without excessive rubbing against the sides. When you start an electric pump, it's generally best to begin in a stimulation or massage mode, if available, or on a low suction setting. If your baby is frequently breastfeeding directly, you may only need to pump at times when a feeding is missed, for instance, while you're at work. In general, it's recommended to mimic a newborn's feeding pattern when pumping, about every 2 to 3 hours, with each session lasting 15 to 20 minutes. If a mother needs to build or maintain supply, especially when the baby is not nursing, such as during the workday, she should pump on a regular schedule. For example, a working mom might pump 3 times during a workday, mid-morning, lunchtime, and mid-afternoon. At night, if the baby sleeps for an extended stretch without feeding, the mother may need to add an extra pumping session late at night or early morning to prevent overengorgement and to maintain supply. The benefit of using a pump is flexibility. You can schedule pumping around your day as long as the total number of breast emptyings, feeding plus pumping, in 24 hours is around 8 to 12 times, which is typically enough to keep up milk production. Remember that each person is different. Some mothers have a larger milk storage capacity and can pump fewer times, while others may need more frequent stimulation. Pay attention to your baby's needs and your own comfort, and gradually find the pumping frequency and schedule that works best for you. Breast milk storage and handling. It's important to store pumped breast milk safely for future use. Always use clean, sterilized breast milk storage bottles or bags, and label them with the date and time of expression. Freshly expressed milk can be kept at room temperature for about 4 hours. If it will be longer before use, it should be refrigerated or frozen as soon as possible. Generally, breast milk can be stored in the refrigerator around 4 degrees Celsius or 40 degrees Fahrenheit for about 4 days, and in a freezer at minus 18 degrees Celsius, 0 degrees Fahrenheit or below, for up to 6 months, and even up to 12 months at most, though using it within 6 months is best for taste and nutritional quality. When you're ready to use frozen milk, thaw it by moving it to the refrigerator overnight or by gently warming the sealed bag or bottle in lukewarm water. Never microwave breast milk, as this can destroy nutrients and create hot spots. Once thawed, milk can be kept in the fridge for up to 24 hours, but it should not be refrozen. When feeding, warm the stored milk by placing the container in warm water until it reaches body temperature before giving it to your baby. Only take out the amount you need for a feeding to avoid wasting any precious milk. Remember to follow a first-in, first-out system. Use the oldest stored milk first. Proper storage habits will ensure your baby can enjoy safe and fresh breast milk at any time. After each use of the breast pump, it's essential to promptly clean all parts that came into contact with milk. This includes the flange, valves, membranes, bottles, and any tubing if applicable. To clean, first disassemble all the parts and rinse them under running water to remove any milk residue, then wash each piece thoroughly with warm, soapy water. You can use a dedicated bottle brush to scrub any narrow or hard-to-reach areas. Rinse all parts well with clean water to remove all soap. After washing, place the parts on a clean paper towel or drying rack and let them air dry completely. If possible, sterilize the pump parts at least once daily by boiling them in water or using a steam sterilizer. This is especially important if your baby is very young, premature, or has a weakened immune system. Note that the pump's motor unit should not be submerged in water. Simply wipe the exterior with a clean, damp cloth and keep it dry. Proper and thorough cleaning prevents bacteria growth and ensures that your baby's milk stays safe. Make it a routine to clean the pump after every session. This habit is crucial for the health of both mother and baby. Medela. A renowned Swiss brand, Medela pumps are used by many hospitals and mothers worldwide. Medela's electric breast pumps are known for their reliability and durability. For example, the Pump in Style, Swing Maxi, and Freestyle series are highly praised models. They offer consistent suction, massage modes, and come with comprehensive accessories, making them very suitable for working moms. Medela bottles and parts are also easily available, which is convenient for moms who want a one-stop solution for pumping and milk storage. Breastfeeding is one of the most precious gifts you can give your baby. It provides complete nutrition and immune protection, and it strengthens the emotional bond between you and your child. By mastering proper nursing positions and techniques, mothers can overcome the various challenges that might arise during the breastfeeding journey. And by wisely using a breast pump as a helpful tool, you can make breastfeeding more flexible and convenient, ensuring that your baby can still receive the benefits of breast milk even when you cannot nurse in person. From choosing the right pump, using and cleaning it correctly, to storing milk and persevering with breastfeeding, every careful step you take will pay off in your baby's healthy and robust growth. We hope the tips and advice in this video help new moms out there and boost your confidence in breastfeeding. Armed with professional knowledge and scientific methods, you'll have strong support throughout this wonderful parenting journey. Thank you for watching and being with us. We wish every mom success in her breastfeeding experience so that every baby can enjoy the best start in life.